The truth about CT scans, what every older adult in America should know before saying yes to that referral. Not long ago, I went to the hospital for a routine checkup. While I was there, I happened to bump into an old friend, someone I've known for decades, who has spent most of his career working in the radiology department. He's seen more scans than most of us could imagine, and he knows the inner workings of the system. When we found a quiet moment in the hallway, he leaned in and said, "Listen, I probably shouldn't be telling you this, but there are some things about CT scans most patients never hear, and you should know them." What he shared genuinely shocked me. It turns out that CT scans, because of their high cost, have quietly become one of the cash machines of many hospitals. In certain places, not everywhere, but enough to raise eyebrows, there are doctors who, in order to bring in more revenue, will order CT scans even when the medical necessity is questionable. And here's what floored me even more. The radiation exposure from CT scans is more complicated and potentially more concerning than most patients realize. Even many doctors are cautious about how often they personally get them. The double-edged sword of CT scans. The irony is that CT scans are, without question, one of the most valuable diagnostic tools in modern medicine. Think of them as a kind of high-tech X-ray vision, able to reveal detailed images of the body's inner structures. They can catch early signs of disease that would otherwise be invisible, and in emergencies, they can be the difference between life and death. They're indispensable in diagnosing tumors, cardiovascular issues, and neurological problems. In any ER across America, from a small rural hospital in Montana to a major trauma center in New York, CT machines are in constant use. But here's the rub. A CT scan is like a double-edged sword. On one side, it offers precision and speed. On the other, it comes with radiation exposure that we can't completely ignore. For many older adults, the word radiation immediately sparks a fear of cancer. And you know what? That's not completely unfounded. Radiation can increase cancer risk, though the degree depends on dose, frequency, and your personal health profile. How much radiation are we talking about? Here's something most people never think about. You're already being exposed to radiation every single day. It's in sunlight, it's in the soil, it's even in the air inside your home. This is called background radiation, and in the US, the average person gets about 2 to 3 millisieverts, MSV, of it per year. To put that in perspective, a standard chest X-ray delivers around 0.1 MSV. A single CT scan? Depending on the type, it can deliver 20 to 100 times more radiation than that X-ray. For example, a chest CT can be 50 to 70 times the dose of a chest X-ray, roughly 5 to 7 MSV. An abdominal CT can go as high as 10 to 20 MSV. Some specialized or enhanced CTs can be even higher. Why so much more? Because a CT doesn't just take one image like an X-ray. It shoots multiple X-ray beams from different angles, collecting hundreds of slices that a computer then assembles into a detailed 3D picture. The clarity is remarkable, but the cost is a heavier radiation load. My friend admitted something that really stuck with me. Unless it's absolutely necessary, most of us who work in radiology avoid getting CT scans ourselves. The risk isn't enormous, but it's there, and we know enough to avoid unnecessary exposure. Who faces the highest risks? While one CT scan isn't likely to harm you, the risk starts to accumulate if you have several over a short period. For example, a cancer patient in treatment may undergo multiple CTs in a year. Certain groups are more vulnerable. Children. Their cells divide more rapidly, making them more sensitive to radiation. Pregnant women, especially if the scan involves the abdomen, there's potential risk to the fetus. People with existing health issues who may require repeated scans. While there's no absolute proof linking a single CT scan to cancer in a specific person, studies on atomic bomb survivors, nuclear power workers, and other groups exposed to low-level radiation do suggest an increased risk over time. So, why do hospitals still use CT scans so much? It's about weighing risk against benefit. In emergencies, the benefit wins every time. If you arrive in the ER unconscious, a CT scan might quickly detect a brain bleed that could kill you within minutes. If a suspicious lung nodule shows up on an X-ray, a CT can reveal whether it's something that needs urgent treatment. In cases like these, A doctor will put the small potential long-term risk of radiation far below the immediate, life-saving benefit of accurate diagnosis. And for the average person, a single scan is well within safety limits. The body can repair a lot of the cell damage caused by low doses of radiation, as long as you're not getting them too frequently. How to reduce CT scan risks. My friend's 3 golden tips. I asked him, so, if I really do need a CT scan, what can I do to make it as safe as possible? He smiled, leaned in, and gave me 3 practical, patient-friendly tips. 1. Ask if it's absolutely necessary.
Don't be shy.
If your doctor recommends a CT, ask, is there another test that could work instead? Would an MRI or ultrasound give you the same answer? Is this scan going to change the treatment plan? You'd be surprised. In many cases, an X-ray or ultrasound might be enough. For example, a mild case of pneumonia can usually be diagnosed with an X-ray. Yet some clinics still jump to ordering a CT, sometimes unnecessarily. 2. Request a low-dose CT. Modern CT machines can adjust radiation based on your size, the body part being scanned, and the level of detail needed. A low-dose CT can reduce exposure by 30% to 50% without losing much clarity. But here's the catch. Smaller hospitals or older machines may default to standard settings designed for an average adult body. If you're smaller framed, that's more radiation than you need. So speak up. 3. Protect sensitive areas. Radiation affects some tissues more than others. Your thyroid, breast tissue, and reproductive organs are particularly sensitive. Ask for a lead shield or thyroid collar if they're not part of the imaging area. For men, a lead apron over the pelvis is wise. For women, shielding the breasts when possible is a smart precaution. The take-home messages for seniors. If you remember nothing else, remember these 3 things. 1. Don't put CT scans on a pedestal. They're powerful tools, but not always necessary. Choose no radiation tests when you can. 2. Communicate with your doctor. A good physician won't be annoyed if you ask questions. They'll appreciate your involvement. 3. Keep a personal record of your scans. Note the date, the body part scanned, and, if possible, the estimated dose. This helps avoid repeat scans that may not be necessary. If you've got a friend or family member, especially a grandchild, a pregnant daughter, or a fellow senior about to get a CT scan, pass this along. Knowing how to ask the right questions and take basic precautions can make a real difference over time. Because here's the truth. Modern medicine is a gift, but it works best when we, as patients, understand the tools being used on us and how to use them wisely.